Welcome to this special edition of Pop Health Week, recorded live in the Healthcare Now Radio studio at HIMSS 2021 in Las Vegas. Pop Health Week is brought to you by Health Innovation Media. Health Innovation Media brings your brand narrative alive via original or value-added digitally curated content for omni-channel distribution and engagement. Connect with us at www.popupstudio.productions. Welcome, everyone. I'm Greg Masters, Managing Director of Health Innovation Media and the producer co-host of Pop Health Week. Joining me in Healthcare Now Radio studio is my partner, colleague, and lead co-host, Fred Goldstein, President of Accountable Health, LLC. So, Fred, with that introduction, over to you. Who do we have on deck for today's HIMSS 2021 Special Edition?
Thanks, Greg. This episode features Ryne Natzke, the Senior Vice President of Growth and Strategy with Sphere. Welcome, Ryne.
Thanks, Fred. I'm very glad to be here. Nice talking to you.
Yeah, it's a pleasure having you on the show. It's an area we haven't really delved into too deeply, but before we get there, why don't you give our audience a little sense of your background and the company?
Yeah, for sure. So I've been with Sphere for about 3.5 years now, focused a lot on our sales and growth and working a lot with our health systems and our integrated partners. We focus on integrated patient payments and helping facilitate the patient financial experience. Before joining with Sphere, I spent time with Epic and also with HealthX Ventures, an early-stage digital healthcare fund.
And so when you talk about integrating a patient experience around payment, I think of payment, and I'm sure most healthcare facilities do, as sort of the thing that they really don't want to deal with so much, but absolutely have to do it. So what sort of things does Sphere do to help with that patient engagement approach?
Yeah, so we try to be in line with whatever systems they're already using. You really don't want your patients to have a lot of friction when they're paying, right? There might already be within your patient portal. They could be talking to your own staff that are checking them in within your practice management system. So what we do is we create APIs and ways to integrate to those systems so that it makes it as easy as possible to facilitate that transaction, because if a patient's coming in, they're probably not feeling well, they have other things going on. Why make them stress out about making the payment process even harder?
So you talk about this, and you mentioned APIs. So is the system integrated into electronic medical records and things like that?
Yeah, so we do have products that a patient can log into and they can pay, but the vast majority of our customers and the way that we're used is that we are integrated with another system, and a lot of times they don't even know they're using our product because we're totally in line within their patient portal or their practice management system. So the users don't have to, again, jump out from anything else. They feel like they're still in Epic. They feel like they're still in Athena IDX or products like that.
Yeah, and that's always one of the things you know, as a patient myself, I mean, all of us ultimately experience some of this as a patient. It's always figuring out the bill, how do I pay it, and I'm getting these things in the mail or anything, but you've essentially automated that, right? It's coming through either the app or some sort of a message like that?
Yeah, so we have our Health iPass product. They help facilitate it really on the front end. So it starts with an appointment reminder. It's the system reaching out to the patient to say, hey Fred, you've got an appointment with Dr. Smith on Thursday. Are you still going to be able to make it? Why don't you click here to check in? And they can tap in and start going through the process of verifying their insurance information, getting an estimate about what they're actually going to be paying for their visit, putting their card on file to show how they are going to pay for that, all before they even show up, so that instead of getting that clipboard when they check in, they've already done it. It's just sit down, wait, and then go back to the room. And then after their visit, once the claim's adjudicated, rather than sending out that paper statement or even saying, hey, log into the patient portal to pay, assuming that the estimate was good, which almost all the time it is, rather you just send out a message that just says, hey Fred, your claim's been adjudicated, your outstanding balance is this amount, we already have your card on file, you already said you're good for this, we're going to hit your card in the next couple days, so that when you see it in your bank statement, it's already taken care of. They don't have to actually do anything, it's just taken care of automatically. And
as you mentioned, you've already sort of built this into the process of reminding about the appointment and then checking in, et cetera.
Yeah, so it's the full workflow, starting with this appointment is being scheduled. So we'll start that engagement to remind them of the appointment and then walk them through everything they need to do before they come in.
In terms of integrations, you've got clinics you do this with, hospitals, it's the spectrum?
Yeah, so that Health iPass product that I just mentioned, talking about that full patient engagement, that works with a lot of, I'll call them the mid-market clinics, the 20-doc clinics, 50-doc clinics, things like that. But we also are integrated directly with systems like Epic and Allscripts and Athena IDX. So we work with some of the largest health systems in the country. And I think last time I looked, we helped facilitate payments for about 35 of the top 100 health systems in terms of net patient revenue.
Yeah, in terms of facilitating payments, I mean, there's all these rules and regs. I don't know a whole lot about the payment side of it, but I assume you've got to meet these rules and regs around both the healthcare side as well as the financial side. And your system does that, or how do you do that?
Absolutely. PCI is a huge thing when it comes into the payment side of things, and it's a whole different level of compliance rules and regulations independent from HIPAA. So how you treat the card information, how you store the card information, you need to be really careful about what you do there. So what we try to do is, our APIs work in a way so that the health system or our integrated partner, they're never exposed to that sensitive card data. So it comes directly into our system securely. We handle it. We send it out to the processors to get processed and deposited into the funds, but it allows our customers and our integrated partners to really reduce the amount of compliance burden and scope for PCI and make it just a lot easier for them to facilitate payment transactions.
So you're reducing their risk of exposure for security, et cetera.
Yeah, so when you see the things of somebody getting hacked or their data being available, our data isn't even in their systems to even get hacked. So you're much less likely to see somebody, oh, my credit card got stolen by my doctor, because the doctor never had it and never touched their system at all. It just came straight to us and we handled it, and our security and compliance did that for them.
Outside of it. And I assume, I understand there are all sorts of different transaction groups out there, banks you got to work with, et cetera. Is that integrated as well?
Yeah, so we're one API, and that we allow our customers and our partners to really go to any payment platform that's out there. So there's big names out there, like Chase and Fiserv and TSYS and groups like that. We're certified to all of them. So we're kind of a single API that gives them the flexibility to work with whatever financial institution they want to use. We can provide that service ourselves, but especially for larger organizations, they might have a banking partner that provides them a line of credit, or they've been working with for a really long time. You don't want to interrupt that, right? That's a relationship they already have, so we can facilitate them continuing to work with whatever financial partners they're using today.
Mm-hmm. And I know in one of the conversations we had before, you mentioned this practice as an example that might have previously had two different systems in their office to work financially. Is that the case, and you've actually made it one?
Yeah, so it's kind of a pendulum. So if you think about kind of the last 15 years or 20 years of health IT, you had all these disparate systems that were out there. Maybe you had a billing system and you've got your medical record, but you might have a radiology system, or this clinic is using that. And then it kind of swung all to consolidation. Everybody's using Epic, or everybody's using Cerner, or Allscripts. But now with the marketplace and these API marketplaces and these APIs being available, it's swinging a little bit back in the other direction, where there are these other systems that are complementing the EHR and practice management workflows, and it's making it a little bit more, I don't want to say complicated, because these APIs make it a lot easier, but there are systems out there that do really, really interesting, specific things that can maybe complement what the EHR is doing or what the patient portal is doing. So there's no demographic in healthcare, right? So everybody's a patient, everybody needs to pay something. So you can't have a one-size-fits-all solution for how to engage your patients and how to have them pay you. So you might be taking another call center application, or you might be using a system like a VisitPay or something like that does some interesting things around smart payment plans that you're not getting from your EHR vendor. So the health system, Epic's not going away, Cerner's not going away, Allscripts isn't going away, so you're taking payments in multiple places. What we're able to do with our APIs is integrate to all those systems that they're using, whether it's IVR, another piece of software, a kiosk, and put it all in one platform. So you have an insight into what's happening with your transactions and your payments, regardless of where the patient entered and made that transaction.
So it's one place to handle all of your financial transactions with the patient interactions, and then it uses all these other tool sets that they may want above the EHR.
Right, yeah, because we're not necessarily driving the workflow. Our partners and our integrated groups do that, but we're kind of that one platform for all of the financial information, regardless of where that began. And
you mentioned that before HealthyPass, you were sort of in the background operating. Talk a little bit about HealthyPass and how that's moved you sort of out into the foreground.
Yeah, like you said, before we were more of an integrated partner. We had the APIs available for somebody else, but we started running into groups that we want to work with, and but they're working with a system that doesn't want to integrate with us, or they aren't going to get to it for a while. And what HealthyPass does is that they have got 12 plus integrations to systems that we didn't have before, but also one thing that we're really excited about is they drive more transactions. They help collect better. So before we were kind of at the we're kind of dependent on our partners to collect well, right? In order for us to facilitate the transaction. Health iPass allows us to be a little bit more in the driver's seat for organizations that want to use that product, because we can move those payments up to the front of the workflow and they're going to collect better. I think a lot of their customers see somewhere between, maybe they're getting 60-65% of patient collections using their old workflows, their practice management workflows. Once they implement Health iPass, that jumps to 90-95%. So it allows us to kind of capture more payment volume, but also it's a better experience for the patient, it's a better experience for the provider, and ultimately better for their bottom line.
And my apologies for saying Health iPass incorrectly. I need to put my glasses on sometimes when I'm doing these interviews. But you talk about the patient experience, and that's really a critical area now. Especially, these patients score these things out, you get your surveys back, and obviously the financials are something that can just skyrocket a patient's stress level, et cetera. Talk a little bit about the impacts you've seen on things like Press Ganey and stuff like that.
Yeah, so a lot of the survey feedback, you get your Press Ganey score in your mail, it's a couple weeks, maybe a few days after your visit, and when you're filling that out, usually you think of what's the last touch point with them, and the last touch point with them is probably getting a bill in the mail. So if that experience isn't good, that's going to be the first thing you think of when you're scoring your doctor, the clinic, or your last appointment. You're not remembering what happened 2 weeks ago, 3 weeks ago, 4 weeks ago when you're filling that out. So if that financial experience is good, that's going to be the taste in your mouth when you're filling that out, when you're thinking about your provider. So those scores will go up, the patient experience goes up, and they have a better sense of their experience with their doctor or their clinic.
Right, better overall happiness, satisfaction with what was going on with the practice, not just from, hey, I sat in the room and hey, that went well and doctor treated me nicely, and the nurse in the front, but also that whole billing prospect, which is, as you said, it's a little bit of a touchy point to deal with for all of us at times when we see that come through. And in terms of Health iPass, you talked about get appointment reminders. It also does things like real-time eligibility and things like that, so it connects and provides the information on what insurance individuals have?
Yeah, so when you're checking in, you're getting a personalized estimation of what you owe. So if you've hit your out-of-pocket maximum for the year, it'll tell you that. If you're in the first half of the year and you have a high deductible plan and you have a little bit more responsibility out of your own pocket, it'll let you know that. So it's a personalized estimation based off of your visit type, based off of the clinic you're going to, and based off of what's going on with your specific health plan.
Fantastic. And if you're just tuning in, our guest on Pop Health Week is Ryne Natzke, Senior Vice President of Growth and Strategy with Sphere. So Ryne, as people look at this, and obviously hospitals worry about this, but cash flow is critically important for a practice. What are you seeing in terms of how this improves various efficiencies or things like that?
Well, if you look back, again, 10, 15 years ago, patient responsibility was probably closer to 10% of your revenue. And now it's closer to 25, 30%. So before, if you only collected 60%, you can write off the rest. It's not that big of a deal. You can't write off 40% of 30% of your revenue, right? That's a much bigger piece there. So it's a lot more top of mind of how do we collect better? And it's not just shaking down patients harder, right? It's not just having more phone calls to them. That experience has to be better. You have to be engaged with them. They have to know. Patients don't not pay their bill because they can't afford it for the most part. It's because they don't understand it. And when they called in, the doctor's office said, call the insurance company. And the insurance company says, oh, you got to call your clinic, right? So if they actually know what they are owed, they're much more likely to pay if it's very clear for them. And they're going to pay more promptly because they're not trying to find 45 minutes to call in or whatever it is to get some of that information. So, and then everybody is, because it's a bigger part of the revenue, you really don't want to wait an extra 2-3 months after the visit to actually collect this. So as much as you can collect up front, using things like estimations and getting a card on file to speed up that process is really going to be helpful for the bottom line for these health systems. Mm-hmm.
Yeah, when you think about this whole move to the high deductible health care and plans like that really put a fairly substantial onus on individuals themselves, it's critical to know exactly what it's right. And I've seen so many times, I've talked to individuals who say, well, I got a bill, I paid it, and then I found out it wasn't right. I overpaid it or something because there was something else that came through, but you've integrated with the health plan or that data set as well as the provider practices?
Yeah, or another thing that happens is they get a bill and then they pay it and then they get another bill from the anesthesiology group or they get the facility charges, right? And it's like, oh, I already paid this. Why do I need to pay this one? So sometimes it's kind of a race. Who can get the bill out first because they're the ones that's going to get paid first. So some of our partners are doing really cool things where they're consolidating all of that. So it's just one place to see everything, what the facility charges, the professional charges, anesthesiology group, whatever it is, so that it's one place to see all of that in one information rather than having a really fragmented experience for that.
And they run that whole thing through your platform and system.
We're going to handle, we're going to handle the payment part of it.
Right.
So, but a lot of times our partners like a VisitPay, HealthIPass can do this as well, where they're going to consolidate those disparate bills to make it a much better experience for that patient or their family member if it's somebody else paying for it.
Right. And are you seeing, obviously COVID changed stuff quite a bit, especially around, and really once again highlight the importance of getting cash in, especially for many of these practices. So do you have any feedback from practices on what they've seen as they've implemented HealthIPass and other things like that?
Yeah, so a lot of times you pay your copay or you pay your balance due when you show up, right? You're standing face to face, you're at the front desk, you're swiping your card on the terminal that's right there. People are shifting that forward to say pay on your own device before you even show up, because we don't want people to sit in our waiting room for 15 minutes. We want to reduce that time where you are sitting there talking to somebody across a desk. So as much as you can do that beforehand, whether that's even in the car, pushing a text message to a patient to say, hey, we'll call you when you come in. Here's how you can pay for your copay for this visit before you even walk in the door, or even before they even show up while they're registering.
So it not only has it made it more efficient, you don't have staff time necessarily there sitting with the person, but you've actually created a safer environment for that individual to interact with your healthcare system.
Absolutely, yep.
And in terms of HealthIPass from a hospital perspective, does it connect, or could you run payment systems through that, like put them on a payment plan or something like that? Yeah,
payment plans are getting more and more common, especially with these high deductible plans. So you'll have a hospital visit, and maybe you'll have a couple $1,000 balance, and you've probably seen stories, and this isn't specific to healthcare, but a lot of the country can't afford a $500 surprise bill. So what are you going to do when you have a $2,500 bill from a hospital visit? Because hospital bills really aren't planned either, right? But you also you don't want to give everybody the same payment plan, because some people are going to be able to pay, and you want to get that money in, you want to finish up that transaction, but other ones can't. So using different technology, again, one of our partners, VisitPay, is great at this. What they do is they profile the patient to say, hey, this is Fred. He can pay everything right here. Let's send him the whole bill. Versus, this is Ryne. Why don't we we think he can do $350 a month, so why don't we split him up at $350 a month, get his card on file, automatically hit it on the third of the month or whatever date it is, and then spread that out over 5 payments.
Uh-huh. And yeah, you probably should have reversed the whole thing. I think I'm the one who gets the bill and says, oh, I can't handle that thing. But and that can be set up by the facility or the practice to say they get the results of something like that, and they say, that seems to make sense, let's go ahead and do that.
Yeah, and using technology like that, it kind of drives whoever, maybe it's a payment that you're talking to somebody in the billing office over the phone, and it can kind of coach them to kind of steer them in the right direction to say, hey, this is Ryne, he's calling in, this is the payment plan, or this is the process based off of what we know from him, know about him and his financial profile and what he can do.
Mm-hmm. And do you have information on improvements in cash flow or things like that associated with the use of the system?
I would say for a lot of it is our partners. For HealthIPass, what they've seen is, the 65% to the 90% patient collection. So they have seen a big jump in getting that card on file and facilitating those transactions.
Right, and can it also, I assume it can facilitate, you could load a card, you could load a bank account or things like that?
Credit card, ACH, for a checking account, HSA, FSA cards, all that can be run through our platform.
And then once you're in the system, that's just then moving the funds across your platform through their different to their different banks or whatever.
Yeah, and that's a big part of the security features that we're talking before. Again, if one of our partners gets hacked, they don't have the card in their system to even be available. We give them a token, and it's just a meaningless string of digits, letters and numbers that they pass to us to say, all right, I'm ready to process a transaction. Here it's 1, 2, 3 ABC, and then we match it up with the card information on our end to process that transaction. So they don't have to actually store some of they don't have to score any of the PAN information on the card.
Yeah, and I think okay, you're busy trying to run your practice or trying to run your hospital. Obviously, the cash flow is critical. Getting paid is critical, but it's not really an area of expertise. So being able to turn that over to somebody who understands how that system works and make sure it all flows smoothly is just critical for these places.
Well, and it's a lot of work. I mean, to be PCI compliant, you have to go through quite a few hoops. You have to work with an assessor. So if you are using technology that helps reduce your scope, that process is just a lot simpler to get through.
And because you're integrated, so if people are using a certain platform, they can then choose to use your system that's integrated with that platform, or?
Yeah, so a lot of our partners will kind of be along for the ride. When somebody's using their system, they'll also just be using us in the background, and maybe they're a reseller or they're white labeling it, and maybe they know it. But in other cases, they could be using us directly. They could reach out to us to work for it. But also, a lot of our customers, they're complicated health systems. They're doing a lot of things. They might have their own website that's collecting payments, and then they'll code directly to our API in a custom solution that they have.
And is this system available both for large healthcare systems as well as individual practices or providers they could potentially use something like this?
Absolutely, yeah. We work with some of the biggest health systems in the country all the way down, and then we work mid-market all the way down. So we have solutions and partners that really run the gamut all the way across the healthcare spectrum.
And where do you think this is ultimately go? Everyone's obviously trying to make things easier. That's the end of the game. And as you talked about early on, it is an engagement play in a sense. If you're engaged and you're not upset with that provider because of some crazy billing thing, are there anything coming out that you see that might be different around this or that's going to make it even better for a patient experience?
Well, I think what a lot of the EHRs are doing with their marketplaces and their APIs, they're making what I'll call the front end of this a lot easier, because they're making data exchange for stuff like a balance or a payment being posted to the patient's account, and information on that side is a lot easier. But then if you look on the back end, if each of those systems has their own separate, disparate payment integration and their own separate, disparate financial institution backing all of those things, it can get really complicated on the infrastructure side of things, because now all of a sudden you have 5 different merchant accounts with 5 different financial institutions making all sorts of deposits and things that it's a little bit harder to reconcile. Using our APIs and what we've seen with a lot of our customers is they'll say, all right, we're running everything through Sphere. We're going to push all of our transactions and have you guys work together and integrate within your system, so that it makes it, again, a lot easier to see what's happening regardless of where those transactions are actually happening. So it's what I'm seeing is kind of more of the cleanup on the back end of the infrastructure side of things, because they were, hey, the rev cycle wants this, Treasury, but then Treasury's like, wait, hold on a second, that they're not using a payment integration that we know. We need to figure out what's going on from a merchant account. That's not necessarily top of mind when you're thinking about the patient experience, but it is becoming more and more of a thing.
And in terms of what you're interacting with the patients, et cetera, are there reports that come out of your system, or is it that data feeds into another system and they pull their reports from there around interactions, payment, things like that?
So we're going to have the transactional information. We're going to be handling a lot of what's actually happening from money moving from point A to point B. So that's where we are really coming in, and then so we have got great reports for that, but we also have reporting APIs where our partners can kind of pull in and use that same information to maybe marry it up with patient information that they have in their system.
So they can extract that data through an API to then go do additional research or studies or look at something around what's going on with their payments.
Yep, absolutely.
Got it. As you look at this space, what excites you in the future? Is there anything, I mean, sometimes I think about payments, oh my gosh, is there anything exciting about that? But what sort of excites you about this area and what you're doing?
Well, what's exciting about it is that patient engagement. Like I said, patients don't want to pay, or they don't not pay because they can't afford it for the most part. It's because it's confusing. It's because it's disjointed, and you're not reaching the patient where they want to be the most successful for that experience. So what I think is really exciting is bringing what we've seen in other industries to healthcare. And I know it's kind of a cliche, right, of bringing Amazon to healthcare, but when's the last time you bought stuff on Amazon and thought, paying, that was really hard. Like that's just that's not even a thought you have. But when you think about your last bill that you paid with your doctor, it probably wasn't as easy as Amazon. So it is kind of a really apt thing, and I think we're getting better and better at making that patient financial experience much better and giving them more of a peace of mind and making that part of it a lot less stressful.
Yeah, maybe a cliche, as you said, but it's been years that many of us have been beating this thing up. We need to bring in some of this expertise that we see, or the simplicity that we see other types of organizations and areas of your economy interact with me and bring it into healthcare. So that's really what you're doing.
And we're getting better, but it's absolutely not fixed. Me personally, My daughter had an imaging appointment last June. We got the bill in the mail in May of this year. Just totally out of nowhere, a couple $100. Came in the mail, paper, and like that still happens today. There's still a lot of work to be done.
So was your first call to that place, hey, wait, I need to talk to you about this system we've got?
I don't know. I figured if that's how they were, that's how they were going to handle that. Billing me calling in would have spent a little bit of time, so I would just got a little frustrated and just took care of it.
Yeah. In terms of patient interactions, are there other things that Health iPass is looking to do, or do we have a next iteration where you sort of say, here's what we're trying to get to?
Well, so we want to own as much of that workflow as we can. So what we talked about, you asked about the reminder, right? That's not necessarily what you always think about with a financial experience, is getting that appointment reminder and having that drive financial experience. One thing that we're really excited about that we did release in the last couple of months here is self-scheduling. So even going even further in front of that to allow to schedule the appointment yourself with your provider online, so that we can kind of facilitate that entire workflow and that engagement with the patient even earlier.
Wow. Well, that's really fantastic. It's been a pleasure to have you on, Ryne. I really appreciate you joining us here on Pop Health Week.
Thank you very much for having me. It was great talking to you.
And back to you, Greg.
And thank you, Fred. That is the last word for today's special edition broadcast of Pop Health Week, recorded live in the Healthcare Now radio studio at HIMSS 2021 in Las Vegas. For more information on Healthcare Now radio's lineup of live and on-demand podcasts, including Pop Health Week, go to www.healthcarenowradio.com. And finally, if you're enjoying our work here at Pop Health Week, please subscribe to our channel on the podcast platform of your choice, and do follow us on Twitter by @PopHealthWeek. Bye now.